From an intellectual standpoint, I've been really interested in coaching for a long time, but it wasn't until I actually got coached myself that I became as passionate as I am now about this. I really think this needs to be a part of what we do. So when I was in Wisconsin, I got some data that told me that my re-excision rate was higher than average. That was really hard for me to hear. Once I went through the stages of grief and all of the rationalizations for why that was, I actually decided I wanted to make some changes. And I tried to make changes, but I had a really hard time. When I was in the operating room with a patient on the table, I just fell back into the routines that I was really comfortable with. And so I decided to work with a coach. So I sat down with a coach and we talked about the same things that I knew that I needed to change. But it was that vocalization, that telling somebody else that I was going to do it, that was really important. And then he was able to hold me accountable. So I knew I was going to come back in a month and have to face him, and he was going to ask me if I made the changes that we had talked about. And as a result of working with a coach, of talking about it, of having him ask me questions, give me feedback, of us looking at my practice together, I was able to successfully decrease my re-excision rate by 9% in a year. That meant that 9% less of my patients had to have a second operation. I think that's a really important example of how surgical coaching is effective in improving surgical performance.